In this class, we're going to make our own models, which means we're going to get an impression. This particular impression was made from a model we made here, and this is almost exactly the same as an actual impression would be. So the first step we're going to have to make sure is that this model does not stick to the tissue material. The model we're making here is a soft tissue model, and part of the model will mimic the gums. So as you can see, these aren't your normal preparations. These are actually locations where implants were placed, and it has been picked up in an impression. This is an impression analog. So if we can see here, it has little indexes or indices, and these indices fit exactly into the impression. These here are the implant replicas that we're going to use. This is exactly what the patient has in their mouth. The actual implant is a little longer than this, and it has a screw pattern which is screwed directly into the bone. This surface here is called the platform. Now the platform is located below the gums, just a little bit above the crest of the bone, or the height of the bone. Now the implant platform, depending on the company, it has different shapes. This one is called a trilobe implant because it has 3 little lobes that index to the implant coping, or the pickup impression coping. This goes inside the implant analog like so. When the lobes line up, it goes all the way down. So after it's all the way down, we will screw this little screw into it all the way down until it's tight enough so that this does not move laterally or rotationally. Now once this is one piece, then we place it inside the impression. You see the 3 lobes in there? They will index right against that. So we line up the lobes exactly where they're supposed to be, and then when we put it in, it should click, or you should feel a little click, and rotationally it's going to be stable, so it's not going to rotate, and it's got to be all the way down. So it will look like this. Now we're going to do the same with the rest of them. I'm going to place them in. And make sure that it screws in. Now this one has a problem screwing in, so if that happens, you let me know and I will give you a new analog, because these screws should be able to go in there very smoothly, and if they don't, that means it's either dirty, the implant is dirty, or the screw pattern of it is not good. If we take the screwdriver, we can tighten it down a little bit just to make sure that everything's nice and snug. Now don't crank down on it, just a little bit of tightness. And then we put it back in the implant impression. We're going to line up the lobes and push it all the way down. And we got 2 of them now. Then we're gonna go to the third one, get another analog. And this one is a little bit different. Depends on what the dentist uses. This one has 2 flat surfaces that index, which you have to line up. Actually no, it has three flat surfaces instead of 3 rounded surfaces. You see the difference? These ones are flat, these are round. So the dentist will usually tell you which is which. Pop these in, line up these surfaces and put these in. Okay, so now we know they fit. Next thing we're going to do, this you don't usually do unless you're in our predicament where both the tissue material and the impression are made out of the same material. If they are made out of the same material and we don't put a barrier, then the two will stick together, and when you remove the impression from the stone, the tissue material is going to be stuck to this and the impression will be ruined. Thus, you're going to have to call the dentist and tell him to call back the patient. This is the tissue material, soft tissue material, and this goes into an impression gun which dispenses the material through this tip. This tip has little squiggles in it, and what that does is it mixes the material for you. So now we're going to take the material and put it in the dispenser gun. These need to be retracted. They could be like this. So if they're not like this, then you kind of push this little tab here and pull it back. Then we're gonna take this. There's a tab here, and this goes in a downward position like so, and then we'll close the top down. So this is what the whole thing looks like, and as we press the handle, this will move forward, thus pushing the material out into the tip, and by the time it reaches the end, it will be completely mixed and ready to be dispensed. Now before we do that, we're going to put barrier on it. In this case, we're just going to use simple Vaseline. Now we can use a nice brush, and remember, you don't have to put a whole lot on it, just a light coat will suffice. You don't have to put it all over the impression, just in the areas where you're going to put the tissue material, because that's where we don't want it to stick. Make sure it's covered. So this area here is going to have tissue material, so we can just take the Vaseline and kind of put it on there, and in the back, in the molar area, we're also going to put tissue material. So we're going to study this a little bit and make sure all the areas that we need covered are covered. Okay, so now we put the impression copings back, or the impression positioners, and we push it all the way down. Make sure that the lobes are aligned, and in the back also. Now, sometimes you may have areas like in that posterior where it may be a little bit open areas that you may not want tissue material to get into. Now in those areas we could put some wax. So we're going to get some inlay wax. And fill up those areas, or we can use, maybe we'll use some pink wax instead, so we don't take a chance on staining the tissue material. Now, denture wax is kind of melts at a higher temperature, so we have to heat it up a little bit extra and kind of fill up those little areas that you don't want any tissue material to go into. The tissue material is challenging to cut unless you have a very sharp blade. So we're better off cutting less and kind of blocking out things that we don't want the material to flow into. Some areas you may want them to be a little bit smoother, so in that case you can flow a little bit of wax in there. Okay. So now this impression is ready to receive the tissue material. In some cases, like in those anterior areas, it's going to be a bit challenging to get the tissue material in there, so the best thing to do is kind of start with those areas and kind of when the material gets pushed in, start from there so it kind of goes around the implants. Before you start pressing the material out, we'll wait for it to come out, and then we'll squeeze out a little bit to make sure that the end portion that sits on the surface in the syringe gets pushed out, so we don't use any material that is difficult to set. So we just kind of squeeze some out, just like that, and kind of work quickly. Make sure it goes all the way around. This material is pretty stable, doesn't flow everywhere, so it stays pretty much where you put it. So at this point we just wait for it to set. Make sure you do not cover the implant area here, because we want this to stay in the stone. Just cover the little junctions of the implants, because the idea is to cover the junction. So if we take a look at this, we want that tissue material, oops, we want that tissue material to cover this area here. This is where the implant replica and the impression cylinder or impression coping meet. So that area needs to be covered by the soft tissue material. As if you can see it here, all those junctions are covered with the material on both here and here. So right now we wait for this material to set, which should be maybe about a couple of minutes. So at this point we can just clean up some of the mess we made and just wait. If we notice, it's not set yet, but it is setting. So we will wait a few minutes. Okay, now we test it to see if everything's set. Everything seems to be set. So the next thing we have to do is take a sharp blade, and you see where some of the material flowed into the interproximal areas, right here, right here, areas in the molar. We just have to cut these out. So we just go down with the blade and make sure we don't cut all the way to the implant, but we just go right down to the tooth. And this has to be very sharp, because if it's not, you see how it's dragging the material. Now let's change this blade to a brand new blade. Now brand new blade will cut through much easier. Just like that. You see how it doesn't move the material? It just cuts it. And that's what we're looking for, just to be next to the implant. And the tooth should be open. None of the material should be inside this tooth. So we have that. Let's see the other side. The other side's good. So now we're gonna go and do the molar. And do the other side of the molar. There's the distal. So we got that. So now if we see some areas that are rough, we can take our waxer and just add a little bit of wax there just to smooth it out a little bit. Just don't overdo it. We just do just enough to make this a little smoother area. And that's it. If we got some of the wax on the tissue material, we can just kind of scrape it off, just so that tissue material fits back accurately into the model. So now we're ready to pour. Okay, now everything's set. Our model is ready to be poured. We're gonna put this on here. This is a mechanical scale, so we kind of zero it out. Make sure it's set on 0. And we're going to add the die stone. So what we're going to do is we're going to use about 150 grams of die stone. Okay, that's about 150 grams. So we're going to look at, this is resin rock. So resin rock says, let's see, water powder ratio is for 100 grams is 20. So we're going to use 30 because we're using 150 grams. So 30 grams, 30 milliliters to 150 grams. So I like to use the syringe because it's more accurate. And then 10. Now with resin rock, it kind of looks dry, but as you keep mixing it, it will become looser and looser. You can wet the spatula a little bit. It for about 45 seconds or so. loose it got. This is a resin reinforced die stone. So the next thing we're going to do is we're going to moisten this model so that we have less surface tension. Okay, so here's the die stone. You see how much liquidy it got? It's not so dry anymore. The next thing we're going to do is we're going to wet the model and this will provide less surface tension. Now we're going to use the vibrator, and since this is an upper model, we're going to start by flowing the stone right on the pallet. And very slowly, so that we give the stone time to flow into every part of the teeth. Slowly filling it up. So once the teeth are filled up, then we can just pour the rest in a little bit faster. Once the teeth are filled up and the trough is filled up here, then we can fill up the rest of the base. So here we can use the rest of the stone and just be very careful when we put it on so that it doesn't flop everywhere. Just build it up slowly. If your stone is too loose, at this point you can probably mix in a little bit more powder if you like, since this is the base and you don't want it to flow. Or you can just wait a little bit until the stone hardens or it starts stiffening, and at that point you can take this and kind of pile it up at that time. please try not to put the stone all over this impression, as you may lock the impression into the stone, and when you're trying to remove the model, the impression might rip. Now here's our model completely set, so now we have to try to separate it. So first we try to pull it off. Kind of try to loosen it up. If it's too hard, then we're carefully going to take the plaster knife and wedge it in between the flat areas in the impression, and slowly try to pull it out. Kind of pry it slow and go into each little area of the model and kind of squeeze the knife in between, and you'll be able to pry it out slowly without destroying the impression. Once the model got a little bit looser, then we should be able to pull it out of the impression. It's important to do all the different parts of the model so that everything gets loose, and slowly we can just remove it. And here we go. The model should look like this. Everything should be nice and even, should have separated from the impression. So let's look at it a little bit closer. As we can see, some stone got in there, but we can kind of flake it away. And then eventually we can clean it out. So after this, we take the screwdriver and we can remove the impression copings and return them to the doctor, if this would be a real case, of course. And this is it. Now the next step is to take this model and trim it. If we want to, we can add a little bit of stone here, so it will aid us in articulating the model.